whichever neurological symptoms, they should occur very much abruptly. It should all develop within few minutes time. Then there is a high suspicion of having a stroke. So there, if it is diagnosed as stroke, then it can be classified into whether there is a hemorrhage or there is a thrombosis, that is a clot.
Welcome to Age of Grace, a podcast dedicated to everything that matters to elderly. I'm your host, Pallavi. The series is brought to you by Happiest Health. One of the common neurological conditions that affects elderly is stroke, which can lead to increased dependency and disability. So, what can be done to prevent it? How can caregivers and family members help them? In this series, we speak to Dr. Athulya Kulkarni, neurologist associated with Manipal Hospital, Sarjapura, with over 15 plus years of experience. Hello, doctor. Welcome.
Yes.
So, doctor, in this episode, we want to understand more about stroke in elderly. What are the early signs of stroke in elderly individuals? How can caregivers or family members understand this quickly and help them?
The symptoms of stroke, whether be it elderly or middle aged, they remain the same. So important symptoms include weakness of the arm or leg, slurring of speech, and impairment of language in the form of difficulty in comprehending spoken words, difficulty in producing words, or sensory abnormalities. All the symptoms, whichever neurological symptoms, they should occur very much abruptly. It should all develop within few minutes time. Then there is a high suspicion of having a stroke.
What are the preventive measures and how can we reduce the risk of this?
So some of the risk factors are preventable or modifiable. So these include hypertension, diabetes, cholesterol levels, smoking, tobacco chewing. So these are lifestyle related diseases which can be modified by the way of medicines, lifestyle modification, such as physical activity, reducing mental stress, and dietary modification, reducing cholesterol containing foods, and then regular health checkups for diabetes and hypertension.
Okay, so that leads to another question, doctor. What immediate steps can one take if we understand that there is a senior citizen at home and this is stroke? What immediate? Because I understand there is some golden time or something like that. Yes, please.
When there is a stroke onset, time should be measured from the last seen normal, and that is to say, when was the patient last seen as normal. So within 4.5 hours of the onset, patient is brought to a center where a scan is possible, where doctors are, emergency medicine is available. So there, if it is diagnosed as stroke, then it can be classified into whether there is a hemorrhage or there is a thrombosis, that is a clot. And if it happens to be a clot in the blood vessel, then that clot can be dissolved by using some injection, intravenous injection, which is called as thrombolytic medicine. So that medicine can lead to immediate recovery of the stroke symptoms. So, and this treatment is feasible only in the stipulated time period of 4.5 hours. Thereafter, the treatment cannot be given. That is why it is very important that if the stroke is suspected, then immediately the patient has to be shifted to a hospital. It's called a stroke-ready hospital. So where the stroke treatment is possible immediately.
Okay. How does one identify that this is stroke? Like a common man wouldn't understand, right?
So it's all based on the symptoms. A for arm, S for speech, and T is time. If you come across a person who is having abnormality, that is facial drooping or arm weakness or speech slurring, then it's time to immediately shift the patient.
Thank you so much for sharing this quick information and relevant and easy information for people like us to follow. Thank you so much, doctor.